Here are the risk factors associated with incontinence for treatments of prostate cancer. The risk factor for incontinence after prostate cancer treatment sort of depends also really with the type of individual when they first present with the disease itself. So if someone starts off before their diagnosis with significant urinary problem, such as an enlarged prostate, and they're struggling to urinate, or having some of the existing problems with urge incontinence where they leak urine already when they feel like they have to go, or they feel like they don't empty their bladder very well, they are at risk itself. Of course, the primary risk then sort of falls upon as well the type of treatment that they choose. As I said previously, stress incontinence tend to go along with the initial recovery aspect once the patients had their prostate removed. Again, not everyone will suffer from stress incontinence early on, but it is certainly one of the potential risk factors that we of course have to discuss with our patient. And then urge incontinence tend to be a little bit more prevalent initially with treatments associated with patients receiving radiation therapy and cryotherapy. So these would be some of the risk factors inherent to each of these type of treatments.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.